Okay, for introduction, Iran's strategic position and its neighborhood with Afghanistan and also Pakistan, and also Iran's location on the transit pathway of narcotic substances to Europe are regarded as the reason of naming Iran as one of the high-risk countries in this issue. You can see the pathway of heroin in all around the world, and we are here in the heart of this pathway. This is congratulations to our country. And United Nations Office on Drug and Crime has reported that the statistics with regards to drug usage has drastically increased recently. Although addiction has been regarded as a sickness since 1954, this is not yet accepted among many healthcare experts and people. You see, I told to my colleagues in the lunch that even now, this is a Persian research that published, and in Persia, even now, many of the people don't know the addiction as a sickness. They say they want to use these materials. A large number of addicted people, even in developed countries, do not show their addiction, and they do not get admitted to addiction treatment centers. Many health problems as HIV/AIDS and deaths due to narcotic substance make this addiction as a health problem in any country such as Iran. Burden, family pressure, rejection by family and friends, economical problems, job-related problems, empowering religious capability and becoming educated in the issue of addiction and its complexity are the reason that they decide to seek for treatment. As my favorite singer John Lennon say, part of me suspects that I'm a loser, and the other part of me thinks I'm God Almighty. More than 50% of treated guys again went to drug usage. I think it is more than 50%, but this is based on a research. In the first 2 months after the treatment, the change of getting involved is more, 2 or 3 months also. The reason of getting trapped again can be all of this: poverty, joblessness, acceptance problem from family and friends side, inappropriate behavior from the family side. It is very important in Iran because our community is family-based, and the main support of the patient is family, not the government. They pay for their treatment, they bring them to treatment, and also like this. Not changing the previous situation, as I told to my patient, it cannot be changed, even you change the situation. Psychic dependence and disturbance in frequently referring to the treatment centers. And I want to mention that what does it mean, the non-compliance? Non-compliance as the inability to equalize the patient's behavior with health care and treatment suggestion. But the important thing is this issue is a complicated process which is affected by various issues such as individual characteristic of the patient, communication with the doctor and patient, and the treatment program. But the point to mention is that non-compliance is not necessarily failure in treatment. It is very important. The question that you asked from the previous lecturer, if some patient don't come to the center, what do you say? You see, we have tons of research about non-compliance in other diseases. For example, non-compliance in diabetics. And they say that many of diabetics that have non-compliance have better quality of life. They are more glad than the people that their blood sugar is narrowly controlled. You see, so we have to look to the non-compliance in other view that it is not the end. Even in those cases that have had a successful treatment, the probability of seeing non-compliance is existed. I told you about relapse in cigarette smoking. Maybe after 20 years, 40 years, it could be relapsed. And what do we want to know? There is a treatment protocol in Iran issued by the government, and Ministry of Health must have followed by all physicians who works in addiction treatment clinics. Sometimes the inspector of Ministry of Health sometimes said that non-compliance is a consequence of not following the protocol by physician. This study was aimed to investigating the reason of non-compliance of the treatment protocol of addiction in three axes: in individual, social, and related factors of the protocol itself, administration problems that might exist for the addicted person himself. So our method is descriptive study, and the population is the patient who is self-admitted to addiction treatment centers, and sample volumes is 254 that we have. This is 276 that we can gather 254. And sampling methods is because of dispersion of addiction treatment centers and the irregularity of the help seeker referral to the centers. The sample method was chosen as a stratified accessible sample. We get the accessible samples. We cannot get another way of sampling. And we make a researcher-made questionnaire with 22 closed items with a 5-degree Likert scale. This questionnaire have three axes about individual factors of non-compliance, social factors of non-compliance, and the factors related to that protocol I mentioned before. And the reliability of this questionnaire was examined by alpha-Cronbach method, and average is acceptable. Okay, the first research question of the study is, what are the individual effective factors on non-compliance? This is the question. If you can see them, I think it is better. For example, I not having motivation for following addiction treatment, or not having enough information about addiction, the existence of physical problems, or not having faith on the effectively of the addiction treatment protocol, and something like this, that it is personal or individual factors in non-compliance. Surprisingly, none of them is not statistically meaningful and significant. So none of them is important for non-compliance, the individual factors. You can see, for example, job for paying for the treatment expenses. Because the expenses of treatment is not so high, and many of the patients was paid by their family. And this is also the statistics of these axis of our research. And what are the effects of social factor in non-compliance? The social factors we have from these nine questions that we said. For example, not financially supplying families. Families are not motivating the addict person. Families are not helping the addict person. The family does not have any faith. The family does not have enough information about treatment. Friends and relatives are not supplying the addicted person. Friends and relatives are not motivating the addicted person, and so on. This is the social factors of non-compliance. Again, surprisingly, this axis is not significantly related to non-compliance. And these questions reveal that the non-compliance is not related to social factors. And final axis is the limitation of that protocol that I mentioned before, that issued by the government, the Ministry of Health. We have 1, 2, 3, 4 questions about the protocols. For example, the difficulty of satisfying treatment expenses lead to non-compliance of treatment plan, or the problem of frequent visit, because they have frequent visit, and if they don't come to the clinic, we must throw him out from the treatment. Yes, done. No problem. Yeah, okay. Okay. I fix it. These factors about the limitation of protocol has meaningfully correlate with non-compliance. It shows that based on our patients, this protocol itself can goes to non-compliance. It could be interpreted that causes such as economic problems in tackling with treatment cost lead to non-compliance of the treatment protocol, admitting for the purpose of taking drugs, drug side effect, and forgetting all the parts of treatment program, they all have been effectively in non-compliance of the treatment protocol. These findings are all statistically significant. Okay, so this is the diagram of all study that see the first cause of non-compliance is limitation of the protocol, and the second is social, and the third is maybe personal. And in discussion about personal factors, we have many studies that I listed here have done in the field of patients following the treatment protocol. And they reported that patients' knowledge and attitude toward the sickness and treatment has got an important role in following or non-compliance of the treatment protocol. It was also reported that when the patients are aware of their sickness, it could be probable that the social and economic issue be less effective. This finding was in agreement with the finding of this study. I agree with these studies, but in clinic, I saw many of my patients that after 3 or 4 years treatment say something totally with addictive behavior. And for example, I know that I describe it thousands of times for these patients. My colleagues is done, but I don't know why they do this. So, of course, we have to explain again and again and again for many more times. Self-introduced addicted people suffer from mental changes, at least for a while. They don't have a positive viewpoint about the treatment procedure, but when they gain enough knowledge and information about the treatment procedure, they can feel some challenges within themselves. For example, you have to show to the family that the abstinence is not for one time. Maybe we have lapse and it is very close in the beginning of the treatment and the duration is coming more far during years. Based on Ellis and Bake's theory, addicted people have many useless and mentally confused viewpoints and do not follow a certain plan in their life. This is very important theory. This is the reason that such people have wrong and negative belief about the treatment procedure and its method. Such people do not have any faith on treatment and regard the treatment protocol as a tiresome and very difficult case. They also leave the treatment plan in middle of the way. These topics was also reported in another studies. This does disagree with our study. And in social factors, we have so many researchers that also the social and family factors have been mentioned as effective factor in following or non-compliance of the treatment procedure. Family support and encouragement can increase the patient's motivation. These findings are in agree with the finding on this study, especially in Iran, that family makes an important role in motivate and accelerate the patient. And about social factors, we are speaking. And summary, the main limitation of the study is that the result is based on patient's viewpoint, but at least now we know that non-compliance is not only the physician's fault. Thank you for your attention, and this is a historical bridge of my town, whose